It's any time from a year from now to January 1st, 2010, unless some change is negotiated. How would you like it if you were running a hotel, which is simple? And they said, you're going to get full responsibility for this hotel anytime from now till 2010. We will not tell you when you have to take over, but you have to have your computers ready, your housekeepers ready, your whole staff ready. You've got to have the
And you have to get the money in order to get ready.
You have now raised the most critical issue.
And one to go with it is the pending earthquake retrofit.
Right. Right. And it's interesting that the same people who pushed hardest to get rid of Sutter are now saying, we can put off the seismic, we can ask for an extension. We can perhaps change the criteria. We don't have to build a hospital now because all of a sudden they're on the other side. And the people who advocated getting rid of Sutter, all of a sudden they are responsible for going to the taxpayers of Marin and raising everybody's taxes. Now, as we all know, that is not a popular position to be in, so they're backing off. Well, which brings up the article in the newspaper.
Yeah, I was going to ask you about that because it sounds like Sutter's just taking money out of Marin General to the tune of, that was $30-some-odd million?
Yeah, a lot. Well,
what's that all about?
What that article doesn't tell you is that when Sutter came, they came knowing their obligation to rebuild the hospital to be seismically safe. They knew that. And they planned their budget to set aside money to do the necessary planning and so forth so that Marin General could be a compliant hospital.
They had a savings account for the...
Yes.
Okay.
Any reasonable family would tell you if you're going to build a new house, you start by putting money away. Okay. Sutter is part of a bigger Bay Area system, Northern California. They have 22 hospitals, and for years and years and years, they worked with bringing all their hospitals up to seismic standards. Novato Hospital passes the seismic test. It's a modern hospital. They were putting money away. Okay. They presented it to the board with the initial plans and a lot of discussion, and the board says, no way, we don't want your hospital. We will build it ourselves. Well, at that point, Sutter, which had been putting money in the hospital construction planning savings account, was freed up, and it was the people on the board who rejected the way they intended to build it. Now Sutter has, for example, St. Luke's in San Francisco, which is part of their network, but they have to have help. So Sutter will take the funds that they allocated to construction and move them around in that system.
Okay. Margaret, did you have any other point that you'd like to add right here?
You as a voter need to think about candidates who are willing, even in our competitive healthcare system, to work cooperatively and share services with Kaiser, with Novato, with the Marin Community Clinic. Sharing services is more cost effective for everybody. And the other thing is, if it's a highly specialized, expensive service, like a burn center or a intensive care unit for very tiny babies and so forth, you only need one of those in a region like the Bay Area.
Right.
The issue is getting the people from Marin General, when the problem presents itself, quickly to the regional center that has a full staff that does nothing but burns.
Right. And they do it better.
And they do it better.
And they probably do it for less money.
And a candidate who says we can do it all ourselves in this building doesn't understand the crisis in healthcare.
Thank you.